Good evening, all of you. I think you can able to hear my voice clearly, and I am sharing the screen. You can able to see the screen also, no? So we will start the topics. The forensic medicine. Today we are going to see uh, the topic of the head injury. So the head injury part here, what I am taught is I didn't go through the detailed theory part. So I will touch the theory part most of the time. Without theory, you can't understand the questions. So after finishing the theory part of the head injury, we are going to discuss the MCQs. Around 10 to 15 MCQs we will discuss. And after that, then also we will discuss the MCQs regarding the injuries, that common blunt force injuries and sharp force injuries also we will discuss, only the MCQs. So here first we will move into the topic. First we will see the head injury theory part, then we will see some questions. So when you take the head injury, usually what will happen is that without knowing the basic mechanism or anatomy, you can't understand how the head injury is caused. So first we will start with the anatomy. If you know the anatomy and the basic structures, then you can able to create and you can identify and you can able to answer the questions also. So the anatomy of the head, usually you know there are three layers: scalp, skull bone, and brain. Scalp means there was a thick, dense skin. The scalp means S stand for skin, C stand for connective tissue, A for aponeurosis, and L for loose areolar tissues and pericranium. So these are the thick five layers. So it's firmly attached to the over the skull bone. So what will happen? Usually, if there are any contusions over there, you didn't see because of the thick layer and firmly attached to the bone. So that is the thing. This is different from the other part of the skin, and also it have hair. It also hiding the injuries. The second part is the bone part. It's also different part from the other aspect of the bone. It's a flat bone. So that also have some difference from the other part. So here you can know there are three layers: outer layer and middle diplo layer and inner table. So in between you can see there are blood vessels. So in that only the blood vessels usually after fracture or something it can bleed. So it can enter into the skin also there. So if there are small injury to the skin, it will get more profuse bleeding. So it mimic as a cut injury. Then the cover, then the underlying there is a brain. Brain has covering. You all know there are three coverings. There is a dura. Dura is you can here this first layer is the dural layer. It has two layers and it form outer layer and the inner layer separate and form the dural sinus. This is dural sinus. Then that is the dura mater covering the brain. It's firmly attached to the inner aspect of the table, bone, skull bone. Then the subarachnoid, it's high vascularized area, subarachnoid layer. You can see here below that. In between that, we will go subdural space. Then subarachnoid, there is a pia mater. In the green color, that is pia mater. It's firmly attached to the brain surface. So between the subarachnoid and the pia mater, it's a subarachnoid space. Then the brain. Then you know the blood vessels. Usually there was a called bridging veins. That is from the brain parenchyma, it passes through into the subarachnoid space and it's enter into the subdural space and go into train into the dural sinus. So usually in the head injury part, extradural hemorrhages you don't get from the breathing vessel because this is only involved in the subarachnoid space and subdural space. So if you know this anatomy only, you can easily understand the brain hemorrhages and brain injury. So these are the overview of the uh, part of the head injury. So head injury, I told there are three layers: scalp, outer skin layer, skull bone, and the brain. Scalp, as usual, you will get all injuries, as you all know. Then the skull bone, here some different type of the bone, the thin flat bone. So it causes different type of fracture also, like linear fracture, depressed fracture, comminuted fracture, pond fracture, and ring fracture, and pin fracture. We will see this fracture quickly one by one. Then the brain, you know, in the brain you have no, there are coverings. So you know extra intracranial hemorrhages, you can get extradural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage. Then the cerebral hemorrhage in the inside the brain parenchyma. Then brainstem hemorrhages. That also we should know what is brainstem hemorrhage. Then the special aspect of the head injury part we have to discuss in forensic medicine: concussion, diffuse axonal injury and diffuse vascular injury, and COP and contra-COP injury. These are the overview. If you know under these topics, if you are able to describe these injuries, that is enough in your forensic level. So we move into the skull bone injury, that is fracture. As you all know, we will quickly see the injury pattern. The skull bone have three layers. I told that outer layer and the diplo and the inner table. So outer table, diplo, and inner table. So this type of bone is there. So when the fracture is occurred, usually there's a emissary veins can pass through the diplo area, so it can bleed. And the skull bone, there are even the same person, there are different type of thickness, because temporal area you have thin skull bone, occipital areas you will get thick skull bone. So most of the time the fracture occur in the thin part, and also it has some elevation and buttresses. It called thick area of the bone, so it mostly avoid the fracture. Fracture just doesn't usually happen in the buttress area because of the thick part of the brain. So in the brain, the base of the skull have somewhat thickness, and the temporal area is very thin layer. So different type of skull thickness was there. Then we will see the skull fracture. The linear fracture, first is a linear fracture, is a common fracture, usually occurred, you can see, after usually fall, after hitting the broad surface. That commonly occur in fall. Sometimes the linear fracture indicate the direction of force. The fracture is this way, that indicate this is the force of fracture. So patient can fall this way like that. So the comminuted fracture is a fragment, that is fracture into more than two fragments. So that is called comminuted fracture, several pieces. If the comminuted fracture is not depressed, usually we will call as a spider web or mosaic design. Usually it's not depressed, but there is a comminuted fracture. If it is depressed, we will call depressed fracture. So depressed fracture, we will see next the depressed fracture. What will happen? The comminuted fracture is usually hit on the broader surface. Broader surface, that's why it's not depressed, because in the depressed fracture, usually you will get strike with the heavy weapon in a small surface, small area of striking area, usually hammer or heavy object. When you hit over the bone, you will get this type of depressed fracture. So depressed fracture, the definition is usually the bone should be gone into the up to the diploid level, because full thickness of the outer table should be driven into the diploid layer. So then only we will call it as it's a depressed fracture. Usually it's commonly occur in the assaulted, because most these fracture, linear fracture and mosaic type of fracture, most commonly in the fall, because fall in on a broader surface. But this type of depressed fracture indicate it's a violence, usually assault. Then the pond fracture is same, but that is occur in the small children. Usually in the small children, their bone is not calcified. So what will happen? It's a membranous type. So when we depress, it will go like a pond. Rather than getting comminuted depressed fracture, it will like a pond. So this appearance is there. This is occur in a small children. That is elasticity of the bone was high. That's why you get pond fracture. Then the hinge fracture is a type of fracture usually occurs that involve the base of the skull. That is usually when the direction of force in the side impact. Usually motorcyclists, they fall on a side with a heavy impact. The fracture, I told that in the direction of the fracture usually hold the force. So this is the type, this force injury is there. So hitting on the side of the impact, usually you will get fracture. So this typical fracture we call the middle cranial fossa, other side of the middle cranial fossa. So it is connecting both middle cranial fossa through the pituitary fossa. So complete base of the skull fracture is there, because it's a severe form of fracture, usually in fatal. So here we can see this type of fracture occurs. Usually it's a hinge appearance. The bone will usually separate in the two parts. So that is the typical appearance of hinge fracture, connecting the linear fracture between connecting both middle cranial fossa through the pituitary fossa. So these are the common area, the thin part of the bone of the basal area, so that will get fracture. Then the ring fracture, it's a fracture around the foramen magnum. Usually, the force through the vertebral body passes here, so it will call fracture. So most of the time, this fracture is a road traffic accident. This fracture is fall from height. So fall from height, they land on the buttocks or they land on the feet. The direction of the force transmitted through the vertebral column, and it causes fracture around the foramen magnum. Sometimes fall from the top of the head also, because of the body weight, the vertebra passes this way, and you can get this type of ring fracture. So ring fracture occur usually in fall from height. Those are about the fractures. Then we will move into the important aspect is the intracranial hemorrhages and brain injuries. So when you take the intracranial hemorrhages, mainly we are seeing these extradural hemorrhages, subdural hemorrhages, subarachnoid hemorrhage, cerebral hemorrhage. So you should know the basic mechanism. Here you can see this is usually the dura firmly attached to the inner aspect of the skull bone. So most of the time venous blood very rarely cause EDH because it can't separate the dura. But the arterial blood, usually the high pressurized blood will come out and separate the dura. So usually this area part of the dura attached bone here and this part of the bone attached here. So it will push us this way. So usually in the CT scan, it's a biconvex appearance. Then only we can diagnose this appearance is biconvex. So here you can see this is CT scan, you can see biconvex appearance because dura firmly attached to the bone. So most of the time, the elderly people, usually that dura was firmly attached to the, very firmly attached to the bone. So most of the time, elderly people very rarely get EDH because the dura was firmly attached in elderly. And second type is the subdural hemorrhages. So here the inside the dura and above the arachnoid matter. So subdural hemorrhages usually from the bridging vessels. So you can see here this type of one side one convex area is there. So this is subdural. So why biconvex indicates extradural hemorrhage. One side concave area indicates subdural hemorrhage. This is concave, one side concave area. So you can differentiate subdural from extradural. Then subarachnoid, usually you know the subarachnoid means inside the arachnoid matter. So inside the arachnoid matter there is a pia. So pia usually adjacent to the sulcus and gyrus. So subarachnoid go into the sulcus and gyrus. So you can see here this type of white area and this area go into the brain. So when it's subarachnoid only, it will go into the sulcus area. So this is sulcus area. You can get blood. So this is subarachnoid hemorrhage. Appearance of subarachnoid hemorrhage. These are subarachnoid hemorrhage into the subarachnoid sphere. Then cerebral hemorrhages after usually the natural causes or any traumatic causes can cause intracerebral hemorrhage. Usually hypertensive patients get into intracerebral hemorrhages inside the brain. It's appear like this. So we will see one by one the extradural hemorrhages. So extradural hemorrhages of collection of blood into the inner table of the skull bone and outer aspect of the dura. So this is the this calling extradural hemorrhage. Usually it most of the time traumatic because after trauma only it can, usually the common site is the temporal site. You will get to damage the blood vessels, middle meningeal artery. You will get bleeding. So most of the time it's traumatic. But sometimes there are possibilities without fracture also you will get EDH. So when the MCQs ask, always means false, but almost always associated with fracture, it's true because almost always means around 90%. Always mean 100%. So almost always, that's not the always, it's almost always associated with fracture, but usually always traumatic. Most of the time it is traumatic. Very rarely we get natural causes. So majority associated with middle meningeal artery damage. So usually located at the site of the area, temporal region. The commonest site is the around 50 to 70%. It's a temporal region, as you all know, that it damage the middle meningeal vessels. But it is good prognosis because you will get early sign, diagnosis early because there is a lucid interval. You can able to diagnose early and it's outside the brain covering also. So it's not usually if you diagnose early, the prognosis was good comparing to other type of intracranial hemorrhages. Then parietal around 80% is possible. Occipital very rare because it's a thick bone and very rarely get fracture. So occipital bone very rare. And usually what will happen if it is hemorrhages occur, then it will causes space occupying lesions. So that space occupying lesions causes brainstem hemorrhages. We will see how it causes later. The frontal and infratentorial places also possible. The common sources of bleeding, as you all know, the middle meningeal artery. So this is middle meningeal artery and its branches. Whenever the fracture go this way and damage to the middle meningeal artery, you will get EDH. And diploic veins. I told that diploic veins are occur in the skull bone. So sometimes in the fractures from this venous bleeding, you may get, but rarely you can get because venous drainage, but you can get diploic vein. And the sinuses. Sinus, as you all know, sinus also you will get because this is the I already mentioned dural layer. You will get sinus here. So tear of the outer layer of the dura. So bleeding can't enter into the outer aspect of the dura. You will get EDH. Same time you will get STH also. If damage the inner layer of the dura, the bleeding come into the under aspect of the dural layer. So subdural also get. So the dural sinus you will get EDH and the SDH also. Then the EDH is usually I told rarely due to extreme age because very firmly attached to the skull bone. In small children also we very rarely you will get EDH because firmly attached to the skull bone. Usually around 100 to 150 milliliter could be fatal. So it causes severe space occupying lesion and sudden death is occur. So usually you know what is there is a lucid interval. So after the impact patient may get unconscious following the concussion. Well, that the concussion maybe causes unconsciousness, but he will regain the consciousness. But there are period around 4 hours. There are period to time to allow the brain to bleeding into the skull bone, the EDH. So what will happen during these 4 hours? There are no space occupying lesion will develop. So that time patient was survived. So this is the golden period. If we diagnose earlier, we are do the intervention and surgical removal, the patient recovery is complete. So this is the golden period, the lucid interval after impact to when developing the patient to the space occupying lesion. So after getting the 4 hours, it will come around 100 milliliter, 150 collection in the EDA that started to causes compression of the brain, that causes space occupying lesion and gradual deterioration will start. Then we in the second topic, subdural hemorrhages. So subdural hemorrhages is hemorrhages collection under the dural surface over the subarachnoid layer. So under the subdural layer. So here what we are using, this is more common because EDH is very rare, only associated with fracture, but bridging vessels. I told the bridging vessels are the more causative form for the EDH, SDH. So what will happen most of the time it is common and it can move into the any area, but here dura was very attached, so it's appear on the localized area. But here what will happen if you get the subdural hemorrhages, it can move into this way, so you can get all over the brain. It's not localized and it is more common than the EDH. Usually SDH associated with fracture, but without fracture also SDH possible. Commonly when comparing the EDH, SDH fracture is less instant. And it almost always traumatic. Most of the time it's traumatic, but natural and spontaneous causes also possible. These are the common, but this is common in old age and children. That also important because here in the old age people, brain will shrinkage and atrophy, so the space force increase. So subdural space force increase and high vulnerable to the bridging vessels. So what will happen? And same like the children also, brain this subdural space force very high. So children and the old age people more prone to get SDH. That is important. They can ask in the MCQs also. Then the source of bleeding of SDH, as I know, it's a bridging vessels that will come out from the brain surface and enter into the through the subarachnoid spaces and enter into the subdural space. So this is the bridging vessels you can see here. When it's damaged, you will get subdural hemorrhages. Then tear of the inner aspect of the dura also will collect the blood into the subdural space. Then subdural hemorrhages is common. Then extension from the intracerebral hemorrhage, that also possible. Sometimes the intracerebral hemorrhage will become large and it damage the subarachnoid layer and go into the subdural space. So from extension from the ICH also possible. So commonly the bridging vessels are the common reason for the damage of the bridging vessels are the common reason for the SDH, and dural tear and the traumatic extension from the ICH also possible. Then the STH you should know we can able to dating because of the region. The acute mean less than 72 hours. Subacute means 72 to around 1 to 2 weeks. More than 2 weeks we consider as chronic. So usually what will happen initially it appear as a red color appearance, then it will change around subacute time it's become a brown yellow discoloration, it's organized manner because patient can survive some period even though if it is subdural hemorrhage patient sometimes survive. So in long period you will get STH. With the uh, more than 2 weeks, there is a organized manner because inside the subdural hemorrhage, it called inner membrane come out from the dural layer. Then it will absorb all blood from the side and it will form a two layers. So ideally, what you know is subdural hemorrhages is can occur in chronic period, but it can be dating. Dating can be done in autopsy done, but mainly we can do the histology. Usually, what we are taking, we can take the samples from the dural layer according to the inner membrane, false membrane formation, absorption of the blood, and both membrane will attach together, and those linear attachment those things are help to identify the we can able to identify the dating. So dating is important in SDH, but you should know we can dating with a histological manner and the autopsy examination we can dating and it can occur chronic type less than 72 hours it's acute 72 to 2 weeks it's a subacute more than 2 weeks it's a chronic like that we can dating. The mechanism of death, usually you know the SDH, sometimes when the SDH is occur, that means it's associated with traumatic axonal injury, a diffuse axonal injury is there, so that can cause death. Otherwise, it can cause mass effect and space occupying lesion. That you all know the space occupying lesion, brain herniation, damage to the brain stem that lead to the death. So that is the mechanism of death. There are no, I told the traumatic causes and non-traumatic causes are also there. So the non-traumatic causes are here. You can see the drug addicts and carcinoma, intracranial infections, leukemia, hypertension, AV malformation. There's a lot of several non-traumatic natural causes are there. In medical legally, it's important because we have to categorize the hurt, usually fatal in ordinary course of nature. And aging, I told STH, we can age histologically and autopsy. We can do the aging, so that is important. Then it's commonly occur in alcoholic because alcoholics have more prone to get chronic fall, so they can get mild SDH inside the inside the brain, so they can more vulnerable to get alcoholic elderly people and small children usually they can get more vulnerable to get STH. And it's shaken baby syndrome and punch drunk syndrome also we will get STH. The shaken baby syndrome you know there is a syndrome, and the punch drunk syndrome in the boxers they will get repeated impact on the head, they can get SDH. Because why is that? This is SDH can occur without any significant clinical symptoms can occur for long period. The chronic SDH can be occur, but patient sometimes with a mild weakness or mild effect, they can survive for long period. Sometimes we can see the thing in the incidental finding because there's a space, so most of the time they don't get it. The thin SDH they don't get. So chronic event they will get SDH and that's why the SDH is important. We can see in a chronic manner. And then we third is a subarachnoid hemorrhage. Subarachnoid hemorrhage means it's inside the subarachnoid matter over the pia matter, over the brain. So subarachnoid usually inside the subarachnoid. So how we differentiate from SDH from SAH is SDH is above the subarachnoid. So when we wash it out in the autopsy while doing the autopsy, it will go away. But SAH not go away because it's inside the subarachnoid. The subarachnoid over the brain it's covering. So here you can see this is go into the sulcus, gyrus. So when after wash also it's persistent. Yeah. So it is how that's why we are differentiate STH from SAH. The STH both you can get traumatic STH and natural also combined commonly around 50% SAH is commonly. Because most of the time SAH is common when the trauma is occur rather than comparing to the EDH and SDH. SAH is common because SAH is commonly we can see in the traumatic aspect. Even we don't see any EDH and SDH, but SAH is there in the trauma because more vulnerable to get SAH. But it can occur in the natural also. We will see. The traumatic causes, the primary trauma to the brain and extension from the intracranial hemorrhage is also possible. Then lateral aspect of the neck impact. This is one of the important area in the forensic because impact on the side of the upper part of the neck that called CV1 syndrome. That one what will happen is vertebral artery will go into the brain and that it pierces the subarachnoid dura and the subarachnoid at the cervical vertebra one level. So the subarachnoid was attached to the upper part of the cervical vertebra one. So what will happen? There was a small portion, intra subarachnoid portion of the intervertebral artery will go into the area. So what will happen when there is a fracture associated with the cervical vertebra 1, it causes damage to the vertebral artery inside the subarachnoid space because the subarachnoid was attached to the vertebra. So this part is damaged, the vertebral artery, intra portion of the vertebral artery is causes bleeding that causes subarachnoid hemorrhage. That causes CV1 syndrome. Usually we can get impact on the site of the neck, we will get that. Even sudden compression of the neck also we will get after dilatation of the blood vessels inside and increased pressure of the venous that ruptured blood and that also can SAH. Then natural cause, I told natural causes also possible. Common natural cause is the spontaneous rupture of berry aneurysm. So berry aneurysm you should know. This is the vertebral artery. You can see this both are vertebral artery joined to form the basilar artery. So the basilar artery divided into two posterior cerebral artery. This is the internal carotid divided into two middle cerebral artery and anterior cerebral artery. So from this middle cerebral artery to posterior cerebral artery, there is a connecting, this is called posterior communicating artery. Between two anterior cerebral artery, this is connecting the anterior communicating artery. The common site of the berry aneurysm is usually in the middle cerebral artery, the connection of the middle cerebral artery. Usually it occurs from the birth, but some stroma or some other spontaneously it can rupture and it will bleeding into the subarachnoid spots, mainly the basal layer of the brain. So that is the common natural causes of SAH, basal subarachnoid hemorrhage due to rupture of berry aneurysm. There are other causes also. There are AV malformation, hypertension, amyloid angina, angiopathy, and carcinoma. These are the features already you saw. That also cause SAH. Then we move into cerebral injury. The cerebral injury we will mainly see in COPE and contra-COPE injury, concussion and diffuse axonal injury. You quickly see what is that. The COPE and contra-COPE, as you all know, the COPE means the injury at the site of the impact. Contra-COPE means the injury at when the impact is there, it's opposite or diagonally opposite side of the brain. That is contra-COPE injury. So when the impact is here, we will get injuries here. So most of the time the COPE and contra-COPE injuries are there, but usually there was how the COPE injury is there, the direct impact cause damage to the brain and the blood vessels and the coverings. But contra-COPE injury, how it's happened when there is an impact here, what will happen? There was a negative pressure. The brain continuously move. Usually it will occur acceleration and deceleration movement. So common phenomenon is the fall on backwards. What will happen? While fall on backward, there is acceleration of the brain and the skull bone. It will move together. But sudden stop, deceleration after fall, the skull bone will stop immediately, but continuously brain will move. What will happen? Brain go and hit this area. At the same time, there is a relative movement between the bone and the brain. That causes negative pressure. So negative pressure also gives severe injury. At the same time, there is a relative movement between the skull bone and the brain. So whenever there is a irregularity of the skull bone, is there, usually that portion most vulnerable to get the contract injury. So we will see how it's happened. The most common scenario is this backward fall. What will happen? This area, the anterior aspect, anterior fossa, cranial fossa, and the temporal area, this part, more irregular part. When comparing to occipital area, you can see it's a very irregular bone area. So the bone move between the bone and the brain. Brain move between the bone and the inner aspect of the brain. So what will happen? Between there was a relative movement. So that irregularity, that severe causes injury. So comparing to the cope injury, contra-cope injury is severe because there was a significant negative fracture. At the same time, there is a relative movement between the brain and the skull bone causes severe injury. The common phenomena is you will get backfall, you will get injury in the inner aspect of the frontal lobes and the tip of the temporal lobes. Usually, that is the area more vulnerable to get contracope injury. So that is the common phenomenon. Usually, it is causes negative fracture. You also know the comparing to the cope injury, contracope injury is severe. That's why because the negative pressure and the acceleration, deceleration movement and irregularity of the brain, it causes severe damage. So comparing to the, it can get brain EDH is very rare, but STH, SAH, cerebral contusion, cerebral laceration, anything can happen in the contracope injury. Even cope injuries, like cope injuries, all injuries can happen in the contracope injuries. Then the concussion, moving to the concussion. The concussion you have to fulfill 4 criteria. That is, concussion means that is immediate and transient loss of consciousness or neurological deficit. That is one criteria. There's immediate, there should be immediate, that should be transient, only a temporary period. Loss of consciousness or neurological deficit due to trauma to the head. That is the second thing, that there should be a trauma. Then uh, trauma to the head. There are no anatomical or pathological findings. But when you are seeing the CT scan, even histological examination or whatever the things, you don't see any anatomical pathology. So that is the second thing. Then complete recovery. That is, I already mentioned the transient period. So complete recovery is there. So fourth is post-concussional syndrome. It's always associated with post-concussional syndrome. So these 4 criteria should be fulfilled to diagnose the concussion. The concussion is the clinical diagnosis, not the investigation doesn't give any role idea, but you can do the investigation to exclude the injuries. If you find any ADH or STH or any injuries, that you can exclude the concussion. So clinical diagnosis, immediate and transient loss of consciousness or neurological deficit. There are following head trauma. Second, third is no anatomical or pathological finding. Fourth is it associated with post-concussional syndrome. Post-concussional syndrome means retrograde amnesia, headache, giddiness, vomiting. Any of this you can get. The retrograde amnesia means what will happen when there is usually what will happen if you see any event, there was a chemical reaction that will passes the reaction to go into the permanent memory. But what will happen when the impact is occur, it suddenly there is a chemical changes and there was a intrachemical changes. What will happen? That is not go into the memory. So impact you forget it. So you don't know what happened before the impact. So sometimes they are maybe before 2 hours, before 2 hours before the impact you may forget, or sometimes it can only moment, very few minutes before the impact you will remember. So how will you diagnose? You have to ask how you get into the accident. He doesn't know how the impact moment he never regains. So that's the retrograde amnesia. After the impact, he can get into the he get the he can able to describe, but before the impact and how the impact is occur, he can able to demonstrate. That's how we diagnose the retrograde amnesia. Then only we will come to confirm the concussion. So pathophysiology is what will happen. Usually I told there are no any damage describable, but there was a axonal, the neuron axon is still there. The axon damage is not there. Axon is there, but demyelination or sometimes you will get myelination. There was a small defect in the myelin fibers. So that may be possible. That is the only thing. But axon still there. That's how we have to diagnose the concussion. So there are no any demonstrable pathology. That is the important thing. In the naked eye, we didn't see any. Microscopy also, we didn't see. Only the axon will there. But diffuse axonal injury means that axon will damage. So that is how it's okay. Because most of the time, concussion, diffuse axonal injury, all are same mechanism. There should be a shivering movement. That is a diffuse injury, but not in the local impact. Not assaulted. Assault is very unlikely. There's a rotatory movement or acceleration, deceleration movement should be there. That's why it causes concussion. So the diffuse traumatic brain injury or diffuse axonal injuries, I told, the same impact was same. What will happen here? There is a tear in the axon. You can get tear in the axon. So what will happen? That axon will tear. It's a permanent damage, severe damage, very bad prognosis. So that also diffuse injury, because of the diffuse injury, we will see from the axis level the brain will move. So the most of the time in the tendorium cerebri and the central part of the brain area, you will get damage. And shivering movement means you can see all over the axonal region, you will be this type of hemorrhagic areas. So diffuse axonal injuries, there is a severe form of injury. You don't get most of the time patient go into death because severe damage, damage the axon, the neuron damage is there. So it not regain the consciousness. So diagnosis is we can do the histology. What will happen after when you are doing the autopsy? We in the histology, this bulb is fracture. So what will happen? The neurological transmitters and all will come and it's form a retraction bulb. So this is called retraction bulb. So there's a swelling. This is how we have to confirm the diffuse brain axonal injury. So that is the severe form of injury. So these are the things you all know, that extradural EDH and the hemorrhages, cerebellar injuries, and concussion, and the diffuse traumatic or axonal injury. Then we will move into the questions. We will see the questions. Usually it's an interactive question. When I ask the question, you can, if you try to answer the question, it's better we can discuss. So first we will see each and every question you have to read clearly. Sometimes without clear reading, sometimes you may miss something. So you will see the first question is, which of the following are true or false regarding intracranial hemorrhages? So intracranial hemorrhage, true or false? So EDH is more common in extreme age. What is your answer? EDH is more common in extreme age. Yes, false, because I told that extradural hemorrhage firmly attached to the inner aspect of the bone in extreme ages. So very rarely you get. Bilateral frontal and temporal lobes are common sites for contracop injuries to the brain. I told now bilateral because that is the area, common site, irregular bone surface is there and fall from backwards. So that is, you all know the answer, no? That is true. Then heat hematoma. Heat hematoma is an antemortem phenomenon due to burn injury to the head. So the heat hematoma we will see while in the burn, we can see heat hematoma is a collection of the blood into the extradural space in the postmortem. Heat hematoma is a postmortem phenomenon because during the burn, what will happen is that I told there is a diplo veins and all of the veins are there. So usually in the burn, like a shopping bag, the burn dura will go over and sting gauge. So there is, while the sting gauge, there is a space, the negative pressure in the extradural space. So this negative pressure will collect the blood and go into the extradural space. So most of the time, heat hematoma is a antemortem, not the post, it's not an antemortem, it's a postmortem phenomena. Usually it will mimic as a EDH. So that is antemortem mean false. Subdural hemorrhage is always associated with skull fracture. That's why I'm told you have to clearly read the question. Always, there is a difference between always, always, almost is different. Commonly, those are the things you have to. Subdural hemorrhage always mean 100%. Always mean 100% associated with skull fracture. What is false? Because EDH is always associated with skull fracture. That also false because 90%. Almost always means subdural hemorrhage always associated with skull fracture, false. Extradural hemorrhage is always associated with skull fracture. That also false. But extradural hemorrhages almost always associated with skull fracture, true. So that's why you have to clearly read the question. So always you should know that is 100%. Almost always means around 90%. So here, like that, you have to clearly see the question and answer before you go into answer. Then ruptured berry aneurysm is common cause for basal arachnoid hemorrhage. I mentioned, no? So yes, it's true. These are the answers. So then we'll move to next questions. We'll quickly move and view which of the following autopsy findings are the features of increased intracranial pressure? So here the increased intracranial pressure, what will happen is you should know that ungual herniation. I don't know if you can able to understand that you answer this question. Ungual herniation, tonsillar herniation, primary brainstem hemorrhage, and gyri are pale and flattened and sulci are filled. Enlarged ventricular size. What is the ungual herniation is true because when the space occupying lesion is occur, what will happen? The brain doesn't have space for swelling, so it doesn't have space. So that time the brain edema was there. At the same time there is a hemorrhage. So brain try to go into the openings of the brain part. Usually you know that this is the dural attachment, this is the false cerebri, this is the tentorium cerebri. So tentorium cerebri is the area where the temporal lobe is attached. So when you see here, the temporal lobe will go, this is the tentorium cerebri, this tentorium area. So this is called ungual herniation. The inner part of the temporal wall will herniate. Like that, there is a foramen magnum opening. So this area will go. So what will happen is this here cerebellar herniation. That's called tonsillar herniation. So this can occur. Then at the same time, this is the brainstem. The brainstem will stretch. So inside the brainstem, the vessels get damaged and it causes hemorrhages. Usually that called secondary brainstem hemorrhage because there are no primary impact. If the impact is direct to the brainstem and get hemorrhages that called primary brainstem hemorrhage due to space occupying lesion because of the stretching of the inner aspect of the hemorrhages called secondary brainstem hemorrhage. So that secondary brainstem hemorrhage usually occur in the center part of the brainstem. Primary brainstem usually you will get in the peripheral part because of the impact on the direct impact. So here you can able to answer now. You know, ungual herniation true, tonsillar herniation is true. Primary brainstem hemorrhage is false because it's a secondary brainstem hemorrhage. Primary brainstem hemorrhage due to direct impact. Then the gyri are pale and flattened and sulci are filled. That is the one of the feature of edema of the brain. When whatever the hemorrhage is there, whatever the trauma is there, brain get damaged. So that is acute inflammatory changes that causes severe, like other organs, brain also get into uh, brain edema. So brain edema, during the brain edema, what will happen? This surface of the gyri get flattened and sulcus get narrow. So this is the features of brain edema, and the intracranial pressure also will high. So that is true. Enlarged ventricular size is false because you know the side you can see this ventricle wall get small because of the space occupying lesion. This ventricular size wall get into small. That is false. Then regarding extradural hemorrhage, if 100 milliliter is fatal in ordinary course of nature. So the fatal in ordinary course of nature means patient die without, we can tell patient definitely die if you are going to do the treatment, if you are not giving the treatment. The endangered life and the fatal in ordinary course, how can we differentiate it? Usually we have to take the treatment option. Then there was an injury. So injury, after injury we see If the treatment is given, patient, there is a doubt. Sometimes patient may lie or patient may dead. So if the treatment is not given, sometimes patient may lie. So if the treatment is not given, sometimes patient may die. So that is the doubt. We don't know whether if a treatment is given or without we giving the treatment, patient die or not. There is a doubt. So that is called endanger life. But if you are not giving the treatment, patient going to definitely die. That indicate fatal in ordinary course of nature. So we are telling if you are not giving the treatment, surely patient going to die. So that type of thing. So more than 100, if it is around 10 or 30 milliliter of blood collection of EDH, we have doubt whether we don't know whether if you are not doing any surgical intervention, sometimes it will resolve and patient may survive. Sometimes it will go into worsening and patient may die. So around 50 or 30, 40, usually we consider as endangering life. We can't confirm it. But 100 indicate surely there is a space occupying lesion. If you are not doing intervention, patient going to definitely die. So that's why it's true. 100 milliliter means that is fatal in ordinary course of nature. In more localized than the acute subdural hemorrhage, I already mentioned. When you are subdural, we can move all over the brain, but dura firmly attached to the skull bone. So when the fracture is there, it's confined to that area. That's why it's convex appearance in the associated area. So that is true. If unreliable leads to secondary brainstem, unrelieved, it leads to secondary brainstem hemorrhage too. You know, the space occupying lesion causes brainstem hemorrhage. It's due to bleeding from the bridging veins. No, extradural means there are bridging veins only up to the dural sinus, in aspect of the dura. So the damage of the brain's bridging veins only causes SDH and SAH. EDH can't be from the bridging vessels. EDH commonly from the middle meningeal arteries. It's commoner in frontal lobe. Extradural hemorrhage commonly in the site of the impact because the thin part of the bone and middle meningeal artery is there, usually in the temporal side. So that is the common site. Then question 4. Which of the following is true or false regarding SDH? Cause due to tearing of bridging vessels. List your answers. You quickly, I think you can able to answer. Causes due to tearing of bridging veins. SDH. True. Yes. SDH is due to that because you know that bridging vessels are only SDH. SAH also tearing due to bridging vessels. True. SAH also true. Histology is used to do the aging. I already mentioned SDH is a chronic event. We can do histological aging. That is also true. Are known to occur in alcoholics. I told you alcoholic getting frequent fall, and they also sometimes they will get atrophy of the brain that causes large space in the SDH. So that is true. Yes. Midline shift is seen. Yes, if the SDH we can get the space occupation we can get. Is more associated with skull fracture compared to EDH. What is your answer? SDH is more associated with skull fracture compared to EDH. SDH is more associated with skull fracture. SDH comparing to EDH. True or false? Can anyone get false? Yes, because you know EDH is more common associated with fracture because EDH is middle meningeal artery damage. Around 90% of the EDH associated with fracture. Around 50 or 60-50% only associated with SDH because most of the time SDH can occur without fracture. So these are the answers. Then which of the following are true or false regarding brain stem death? So the brain stem death usually important to identify to confirm the brain death. Usually in following RTAs before they are going for the organ transplantation, we have to confirm the brain stem death. So that is important. There was a sequence of examination uh, findings were there. With that only, with around 7 or 8 examination findings, we are doing some tests and reflexes, and only we have to confirm the brain death. So that is mainly we are doing checking the brain stem. So that is there are some reflexes, the corneal reflex, pupillary reflex, yak reflex, and mm, um, normal motor function reflex, and the caloric test reflex, and also we are doing um, oxygen, carboxy. We have to increase the carboxy CO level, and we have to confirm whether patient is responding or not. Like that, there are sequence of reflexes are there. So in that, the based on that only they are asking these questions. So sluggish pupillary reflection suggests impending brainstem death. So it's like pupillary reaction is there. So if the pupillary reaction is not there, that indicate brainstem death. That is true. Oculocephalic reflex is absent. The oculocephalic reflex mean what is that? Ocular reflex is mean usually when we are move the head, the eyes will move opposite to the movement of the head. When we are manually move the head in the unconscious patient, usually even if the brainstem is not dead, but only the unconsciousness, there should be brainstem still working. So when you move the head, the eye will move in the opposite death. But this reflex is absent means that is like a doll's eye. You know, when you are moving the doll, it same time the eyes also moving the same direction. So that is indicate oculocephalic reflex absent. So this absence of ocular reflex indicate doll's eye. So that is also confirm the brain death. So that is true. Gag reflex, we have to do the some put some. Usually, we are manipulating the ET tube or something to test invade the larynx, and we are checking whether it is gag reflex is there. If it is not there, only we can confirm the brain death. So gag reflex remaining intact for 2 hours means false. In brain death, we don't see any gag reflex. The alcohol intoxication should be excluded prior to the diagnosis is important because alcohol intoxication also suppress the brain stem and brain part, so it also mimic as a brain death. So we have to exclude the alcohol, even other sedative drugs also we have to exclude it, and then only we have to confirm the death. So that is true. Reflex becomes sluggish in early brain stem death. So other reflexes also, I told the motor reflex and other reflexes also will get not be there. So these are the things you should know to confirm the brain stem death. So these are the answers. Regarding head injury, you all know we quickly see the SAH is most common intracranial hemorrhages. That's then that SAH more seen. They are then comparing to all intracranial hemorrhage, SAH is common. What do you answer? True or false? SAH is the commonest. That means SAH is the commonest intracranial hemorrhage. STH, SAH, EDH, ICH. So comparing these four, what is your answer? SAH is common. I already mentioned during my class. It's true because why? I told comparing to the STH, SAH is high. Because why is that? Because you know SAH have sometimes you can occur because over the surface of the brain, because usually subarachnoid space have high vascularized area. If you want, you can see here in the brain. If you know the anatomy, you can able to understand. I'll show it you. Here you can see this is PDH is very rare, SDH is this area you didn't see blood vessels. Only you see the bleeding vessels. That are the main source for the bleeding from SDH. But this is subarachnoid space. This is you can see lot of blood vessels and breathing vessels also there. So common whenever the head impact is there, if you get STH, you also associated with SAH. So most of the time, SAH is the common bleeding, intracranial bleeding comparing to the other because SDH is very rare because EDH is very rare because very less blood vessels, only middle meningeal artery. STH is usually dural sinus or the breathing vessels, but SAH is common. Whenever there is a lot of blood vessels are there in the SAH. SAH is a compact of blood. So most of the time, if you damage the breathing vessel, that indicate you are damaging the inside the artery here also, and this small, very small vessels also. So SAH is common comparing to the old. Now I think you can able to understand because of the lot of blood vessels are there. So comparing to the old, SAH is the um, common intracranial hemorrhage. So that's why you have if you know the basic anatomy and the mechanism of the injuries only, you can manipulate and give the answer. So if you know the anatomy and if you remember with the anatomical structures and why it's happened like that, if you correlate only, whenever they are changing this type of question, you can able to think and answer the question. That's why I quickly go through the head injury part. Without doing head injury, if I do this thing, I can explain. So now you are not remember because SAH is lot of blood vessels, bridging vessels, and high vulnerability to get into damage. So SAH is the commonest intracranial hemorrhage. Falling backward causes fracture of the roof of the orbit. That is also true. It's a contra-cope injury. I told like cope injury, contra-cope injuries also can occur. SDH, SAH, fractures, brain injury, contusion, anything can happen. Why it's happen is I told there is a roof come back falling backward. There is a negative pressure. There is a relatively negative impact on the pressure in the bone. The roof of the orbit very thin is a very thin part of the brain skull bone. So that usually get into fracture. So contracope injuries in the falling backward can damage the orbital roof because it has severe force, severe negative force, and the brain can impact into the area of the part. So that is very thin part of the bone, or so anterior cranial fossa. So you will get contracope injury can cause these type of fractures. That is true. Coccygeal fracture are commonly seen in occipital bone. I told there are several thickness was there. So commonly we can see fracture in the thin part of the bone, temporal part, frontal part, or something like that. But Cockback fracture commonly what can occur, but commonly means false because that is a thick part. Occipital area is a thick part of the bone. That's why it's false. SAH is always traumatic. I told you have to clearly answer the questions. SAH is always traumatic false because even EDH is always traumatic. We have to consider because EDH also sometimes there is a possibility of getting some other natural causes, but very rare. But we can ask like that type of question. But STH is always traumatic is surely false. SAH always traumatic is false. Whiplash injuries are commonly seen in fracture of the vertebral bodies. Whiplash injury means it's a vertebral severe sudden movement in front, and there is a whiplash effect. Usually in the drivers and the occupants of the vehicle, they are with the headrest. Usually nowadays we have headrest, but sometimes in the head, if there are no headrest, you will get severe movement between the neck. So that will cause a severe injuries. That is most of the time these type of injuries causes soft tissues rather than comparing to the vertebral bone. It causes severe injury to the soft tissue. So this is common. You can get fracture in the vertebral bodies, but commonly seen in the soft tissue. So when you ask whiplash injuries are commonly seen as a fracture of vertebral bodies, false. Commonly we don't. Whiplash injuries most of the time we are seeing the injuries in the soft tissues. So the commonly means that's why it's false. But whiplash injuries can be seen as a fracture of vertebral body is true. So that's why you have to clearly understand the mechanism and clearly that's it. Here the ultimate goal is you should know which injury is more common, soft tissues or vertebra. So soft tissue injury is common in whiplash injuries. That's why they are asking this type of questions. Then we quickly move into the other questions. I think we don't have time. So the chronic subdural hemorrhage is an incidental finding in elderly eye troll because they can survive without any symptoms. So in the autopsy we will find as an incidental proof. It's uniform red in autopsy. Chronic means that's why it's uniform but not the red. Because chronic it's appear change in the chocolate brown color. Sometimes the chronic even it's absorbed and we don't see much. So sometimes very dark chocolate color or liquefactive changes will there. So chronic means that's why you are asking chronic means false. If it is acute, it's true. Give symptoms of raised intracranial pressure early. That also false. Early. That is the because I told EDH will give early. That's why its prognosis is high. SDH is not like that because most of the time it doesn't give any symptoms for chronic period. Even with the small SDH, the patient survive long period. So early means false. Then the scene in heroin addict, I told that any drug addicts and heroin people, they get frequent fall, they can vulnerable to get the head injuries, and they get brain atrophy. There are more space in the subdural area, so vulnerable people. And give behavioral changes, so because of the SDH, it's brain return and it can cause behavioral change. That's true. Regarding SAH, it's a hemorrhage between arachnoid and pia mater. That is the area, no? Subarachnoid, that is true. Caused due to rupture of venous sinus. The venous sinus SAH. What's your answer? True or false? Now you tell this answer. Your SAH is caused due to rupture of venous sinus. Anyone, if you able to answer this question, true or false? Yes, false. You know, because venous sinus, as you all know, only produce EDH. If outer layer of venous sinus is formed by dura, if outer layer is ruptured, you will get EDH. Inner layer is ruptured, you will get SDH. You don't get SAH. So that is false. So now you can know if you are understanding the mechanism and the anatomy, you can think and answer. They occur due to rupture of Benny aneurysm resulting in accumulation of the blood in the base of the skull. I told that ruptured Benny aneurysm is a common natural cause, spontaneous ruptured Benny aneurysm. I told that circular Phyllis, I told the area where you get, so that is common to SAH. Causes by injury to the lateral side of the neck. That's why I told the CV1 syndrome. The upper part of the neck, usually vertebral artery, enter into at the level of cervical vertebra 1. It will pierce and enter into the dura and enter into the subarachnoid space and go into the brain. So that area, when the damage or fracture associated with cervical vertebra 1, it causes damage to the intra subarachnoid space of the vertebral arteries portion that can cause SAH. That's called CV1 syndrome. It's most commonest form of intracerebral hemorrhage. I told no, that is true. I think it's mistakenly labeled. Commonest form of intracerebral hemorrhage is true. This is wrong. False is wrong. This is true. So that is true. Mistakenly it becomes false. And we'll see in the next topic, next question. Fracture of skull. So it's non-grievous if only in inner table involved. That you all know, all fractures are considered as grievous. So fractures are not a non-grievous. So any fractures or any fracture of the teeth considered as grievous under limb G. So this is false. Depressed fractures are associated with cerebral contusion. So that is the thing because depressed fractures go into the brain and can cause cerebral contusions. So that is true. Rare in temporal area. So that is also false. Usually thin part usually get fracture. Linear fracture are more prominent in bony buttresses. What your answer? This question just tell linear fracture are prominent in bony buttresses. Bony buttresses mean it's true or false. Linear fractures are prominent in bony buttresses. What is bony buttresses? Bony buttresses mean it's a thick part of the bone. Usually, I told that skull bone have thin part and thick part. Some part you will get some elevations and thick ridges like appearance. So the thick part of the bone call it as bony buttresses. So that is more prominent in bony buttress means false, no? The thick part of the bone not get involved. So these are the answers. Hinge fractures are common in motorcyclists is true. This is false. That D1 is false. Mistakenly they put it as true. Linear fractures are prominent in bony buttresses mean false. Usually we don't get, usually it's pair. Usually thin part of the bone only we will get prominence. So this is false. And depressed fracture are that also mistakenly they put it as false. It's true. Depressed fracture associated with cerebral condition is true. And they are in temporal area, I think it's mistakenly they put, yeah. They are in temporal area also false. That is okay. They are in temporal area false. It's okay. And in the concussion. So concussion causes permanent damage to the brain and resolves spontaneously. Histology shows axonal bulbs associated with diffuse axonal injury is non-grievous. So what are your answers? Just I'll check. You can, if you understand the concussion, you can answer this question. First, it's a cause of permanent damage to the brain. What do you think? Permanent damage to the brain. False. Yes. Resolve spontaneously. Yes. Spontaneous resolve is temporary. Histology shows axonal bulbs. Axonal bulbs. What do you think? False. Yes, because axonal bulbs are seen in damage to the axon. So axonal damage, axonal uh, complete axonal damage and tear on the axons. So what will happen after tear? There is a transmitted through the axon, but if there are no connection because of the tear, so that end of the axon will get swelled. So that's called axonal bulb. Usually in the histology, we will see a round shape type of bulb we can see in the axonal end. So that indicate diffuse axonal injury. So the concussion only we can see myelin sheath damage. Sometimes even that also not there. So it's a temporary. Again, myelin sheath will form without any damage. So that is false. Associated with diffuse axonal injury. Concussion associated with diffuse axonal injury. What do you answer? False. Because if it is diffuse axonal injury, it's a permanent damage. It's not a concussion. If diffuse axonal injury means there is a damage, anatomical damage is there, anatomical histological finding is there, so that is not a concussion. So that's true. It's non-grievous. What do you think? It's non-grievous or endangered? True. Do you think concussion is true? Non-grievous. Because concussion, I told, it's a transient loss of consciousness, no? So what is happened, if you diagnose concussion, there is a transient loss of consciousness is there. So during that transient, this is during this unconscious period, what will happen? Patient life is in danger. No? She may get aspirated, she may get tongue will fall backward. So sometimes without treatment, patient may survive. Without any resolution, patient gets survive. But sometimes he may get aspiration and he may going to die. So there is a doubt. His life is in a threatened condition. No, but you don't know whether he can survive or not. Sometimes during the unconscious period, there should be unconscious period. Concussion, the transient loss of consciousness. So the unconscious period is there. So at your level, you think there is an unconscious period. So that unconscious period is endanger his life. So it's a endanger life. So it's false. It's a grievous endanger life under limb H. So it's a grievous. So whatever when you think that concussion, that is unconscious, you think that is there is an unconscious period and retrograde amnesia also there. So that unconscious period, patient's life is in danger. So it's an in danger life. Concussions are diagnosed by transient loss of consciousness. true, no? History of impact on of fixed head. What your answer? There is a history of impact of a fixed head. That is the history was there. Usually fixed head, impact on fixed head. Usually, what is your answer? True or false? Concussion occur in the impact on fixed head. True or false? If you are in doubt, not fixed head. That's the thing. Because concussion, diffuse axonal injury, diffuse vascular injury, all are shivering movement because there should be injury to the all over the brain at the same time. So usually there is a rotatory movement. So most of all of the brain will rotate it, and acceleration deceleration movement. So brain go front and backwards. So that type of with the axis with the brain stem with the axis brain will should be rotated and accelerated decelerated movement should be there. Then only you will get diffuse injury. That means all over the brain same time you will get the force will translated. So that is not the fixed head. Fixed head means while fixed, you had assault with the fixed head, so there are no relating only local effect, EDH, SDH, like that local effect only you will get. You don't get severe shivering type of force. So that's why it's not a fixed head. Usually it's rotatory movement or accelerated retardatory movement only there. So that is false. So that's how sometimes if you have doubt, ideal mechanism should be there. The diffuse axonal injury is a diffuse mechanism, no? All over the brain it will go. Like that concussion also diffusing that, but you don't see any damage to the brain, but diffuse chemical changes, diffuse in force will transmit it. So that is false because diffuse, not the fixed head. So moving head or acceleration or deceleration or rotatory movement should be there. Usually it occurs in the road traffic accident. That's why it's thrown away and fallen back, fallen and sudden deceleration, acceleration. Rather than comparing to the assault, usually concussion occur in the road traffic accident and fall. And retrospective clinical diagnosis. I told that that is the clinical diagnosis. Usually, that is true. Retrograde amnesia is true. That is the one important factor for diagnosis. And post-concussional syndrome, that is true. We have to be careful. It's post-concussional syndrome is associated with, that is true. So mistakenly they put false. This is true. Diffuse axonal injury. Right. Shows axonal swelling in the bulb in the white matter. That is true. Prognosis is good. All know it's very bad. Death usually due to spinal shock. What is your answer? Spinal shock. Because usually I show you that where the diffuse axonal injury damage, no shivering movement. So there is a ventricular area only mainly defected. No, most of the ventricular area defect. So that's why axons are mainly occur in the ventricle and white matter. So that is usually due to the whole brain ventricular axonal damage. So not the spinal shock, mainly in the ventricles of the brain are involved. Rather than comparing the spinal shock, spine is somewhat here. No, the spine means in the vertebra. No, usually it's not the spinal shock. It's a damage to the brain ventricles. Ventricles failure is cause death. That is true. Skull fracture can occur. The can occur means we can, in fact, it's possible now. So that is true. The questions. This is a single best answer. This is not the true or false. So I think they are now we are getting these type of questions. So whenever they are giving this type of questions, you should go every keyword. So it's an adult male. That is a keyword. Adult male admitted to the hospital with a head injury. That is not the hand, head injury. Following assault with a blunt weapon with a small striking surface. Assault. There is a keyword assault with blunt weapon with small striking surface. That is small striking surface is the keyword. Which of the following features are best indicate that is a heavy weapon? So what is your answer? You should have to tell when you examine there was a A depressed fracture is there. There is a history of assault in an adult male. So they told he assaulted with some weapon. So we have to identify whether it is very heavy or non-heavy. So what is the injury pattern will give clue regarding the uh, regarding your finding that is compatible with the heavy weapon. If you find a stellate shape of skull laceration, presence of marginal ablation scholar, STH reduced on the site of the impact, depressed comminuted fracture of the skull, extensive laceration around the laceration. That is the answer D. Yes, D is the single best answer. You have to identify. If there are multiple correct answers should be there, but you have to tell that is single best. With the correct answer, there is a best answer should be given because in this case, the stellate shape of skull laceration can occur with a heavy weapon, but that can occur with the non-heavy weapon also. But heavy weapon can produce stellate shape skull, but that is true. But comparing to the depressed skull fracture, this is very less. So extensive laceration around the laceration also possible with a heavy weapon, but this is the ideal way. The depressed fracture with a small striking surface, the heavy weapon, that is mostly the depressed fracture indicates more accurate to the heavy indicator, that is heavy weapon. So that is the answer. So these are about the questions and answer related to head injury. So we just quickly move into other MCQs quickly. I think we don't have much time. So we quickly, I think you already know this. We can quickly move see some MCQs regarding the injuries, common injuries, mechanical injuries. True or false regarding abrasion. Direction of the force can ascertain. Abrasion do not leave scar. Abrasion usually heal with 7 to 10 days. Abrasion always indicate the site of impact. Pattern abrasion causes by tangential force. So what is the first answer? Direction of force can be ascertained in abrasion. True or false? Yes, true. Because the epidermal tag, you know, the epidermal tag indicate the direction of force. Usually the tangential force. Even if it is perpendicular force also, it will give the pattern aberration indicate that is perpendicular force. Tangential force, you can say this direction or other direction. So direction of the aberration, that aberration is the best indicator for direction of force. Aberration do not leave scar, that is true, no? Usually it's in the superficial layer of the skin, so you don't get scar most of the time. That's why we are using do not leave mean true. Aberration usually heal within 7 to 10 days, true. Most of the time aberration heal within 10 days. Aberration always indicate the site of impact. That is also true, no? But contusion can occur other than the site of impact. Fracture, indirect fracture can other than the site of impact. Laceration, even here, deglowing laceration, other form of laceration can occur other site of the force. But aberration, cut injury, strap injury indicate at the site of the impact. So that is true. Pattern aberration caused by tangential force, it's a perpendicular force. Tangential means horizontal force. That is false. Pattern aberration, you know, that is a perpendicular manner. And question 2 is which of the following statements are true or false regarding contusion? Contusion is collection of the blood inside the blood vessel. So here, you know what is the true or false? Condition of the collection of the blood inside the blood vessels. Condition is collection of the blood inside the blood vessels. True or false? Quickly give answers. We will quickly move. What is your answer? True or false? True. Contusion, I think that's why inside the blood vessel. Contusion inside the blood vessel. I told the contusion definition is following blunt trauma, there is a rupture of the blood vessels and extravasation of the blood, and it will go into the inside the interstitial space, tissue space, and it will fix and coagulated. So these are the things in the definition. So if you go through the definition of contusion, that is the thing. So inside the blood vessels is a hypostasis. Hypostasis, usually there are no damage to the blood vessels. So inside the blood vessels we'll see in the hypostasis. Contusion inside the blood vessels false. The collection of the blood inside the blood vessels. That's why you have to clearly read the things so you don't miss. So that is false because contusion occur into the tissue space, extravasation of the blood. The hypostasis is true. Hypostasis can collect inside the blood vessels. That is true. Contusions are confined to the skin and subcutaneous tissue. True or false? Contusions in the subcutaneous tissues only. What's the answer? True or false? Contusions you can confine. Confine to skin and subcutaneous tissue. Confined mean only it's inside the skin and subcutaneous tissue. That is true or false? False. Because you know contusion can occur anywhere of the skin. Abrasion only confined to the skin. But contusion you can get in the internal organs, you may get the contusion in the brain, you may get contusion in the heart, lungs, internal organs, in liver, any internal organs you can get contusion. So confined to the skin and subcutaneous tissue is false. So that's why you clearly read the sentence and if you know the understanding the mechanism of the contusion definition and how it's occur, only you have to formulate and give the answer. If you know the basic understanding the mechanism and the definition and how it's occur, if you have idea, then you don't miss. Some contusions are never become visible without dissection. That is true. I told sometimes the deep contusion in the muscles sometimes become visible, but sometimes in the head, I already mentioned there's a thick layer of the skin. You don't visible any contusion. So after scalp dissection, we can find there are significant contusion, but while looking over the naked eye, we don't see any contusion. So that is true. Some contusion never become visible. Are pattern when the epidermis is involved. How the pattern contusion is occur? The trampoline contusion. This is the trampoline contusion. How it's occur? It's not the epidermis, it's the dermis. I already mentioned there is a pattern contusion is like this. Now when someone is hit here, what will happen? This is the epidermis and this is the dermis part. So dermis part has some segmental appearance. No? So intradermal contusion causes pattern confusion. So this is dermis, this is epidermis, this is dermis, it has blood vessel. The condition is there is an impact over the head. What will happen? This area will stretch and it get bleeding and collected in the area. This area will stretch and get into the bleeding, so collect blood inside there. So edges of the weapon. So here like this, the edges of the weapon only, you will get contusion. The impact site of the weapon is a free normal skin. So this indicates the width of the weapon. So here you can see this is the width of the weapon. So this area skin was normal because this area only we will get contusion because it's an intradermal contusion. The pattern contusion are due to intradermal contusion. So adjacent site of the contact weapon only you will get. But imprint abrasion you will get only involve the epidermis. Imprint abrasion is epidermis. Imprint contusion is the dermis. So that's why it's a false. No, it's a pattern when they in epidermis false. It's dermis. Become yellowish in color shortly before disappearance. True, because there is a color sequence is there. Usually we don't ask the exact time like abrasion, but you know less than 18 hours you don't see yellow color. More, if you are see the yellow color condition and that indicate it should be more than 18 hours. That is the only confirmed thing we can tell. So M6 also we will ask like that. So that is the way. So these are the things you will know about the contusion. So yellowish discoloration usually due to bilirubin. So bilirubin causes this type of yellow discoloration. So it's before shortly disappearing the condition, it's a yellow appearance. That is true. Then we move the next slide. Which of the following statements are true or false regarding stab injury? So you all know the surface length of the injury reflect the length of the weapon. So surface length means length of the injury indicate length of the weapon. That is, I think it's false. We have mistakenly put as true because surface length indicate the width of the weapon. No, it's indicate the width of the weapon. So when the weapon is like this, there should be surface length indicate the width of the weapon. So depth only give the length of the weapon. Depth of the injury will give the length of the weapon. And defense steps are found on the chest, usually defense injuries in the limbs, upper limbs and lower limbs. The chest is false. Step in the right ventricle of the heart more fatal when compared to left ventricular step because right ventricular step is more fatal because what right ventricle is very thin, left ventricle is very thick. So when the stab occurs in the left ventricle after removing the weapon, usually because of the intercussion of the muscle fiber, thick muscle fiber, bleeding is very less. But thin thickness of the right ventricle, bleeding is more from the heart. Severe bleeding is here. So sudden cardiac tamponade, it causes sudden cardiac tamponade and sudden death. So usually right ventricular step is more vulnerable, more fatal to comparing the left ventricular step. So that is true. Right ventricular is more fatal, true. If one end is cut, possible weapon is single cutting edge. You know that one cutting edge and other is blunt. Usually the one edge indicate there is a one cutting edge weapon. If transfixed a hard bone, the force could be extended. So usually that is true. Extensive force, if it is damage to the heart bone, that indicates, if you have mistakenly brought it as false, it's true. It is damage to the heart bones that indicate even there's a severe force there. Then only it will damage the heart bone. So that is true. Extensive force. Which of the following are true or false regarding lacerations? Are characterized by tissue bridging? You all know, true. Laceration tissue bridging is there. Laceration in the chest healed with the permanent scar is considered as grievous under limb F. What is your answer? B. Laceration in the chest healed with a permanent scar is considered as grievous under limb F. Grievous. What is your answer? True or false? It's false, no? Because if it is okay in the chest, we don't tell it's a grievous. Because you know only the facial disfiguration only we consider as grievous. Laceration okay in other side of the effect dealing with the scar is not a permanent because it's not a grievous because there are no permanent disfiguration of the face or head. Only if it is okay in the face only we consider as grievous. This is false. Then laceration in the head mimic as an insist spoon. I told that is possible because of the appearance of the skull appearance, heavy bleeding, and the tear was very resembled in true. It always indicates the site of impact false. Only the abrasion only indicates the site of impact. Laceration can be okay, other than the site of impact. Laceration have clean edges false. Only cut injuries have clean edges. Laceration edges are abrasion and contusion and irregular edges are there. So that is false. Then regarding abrasion, scab formation indicates survival. What do you answer regarding abrasion? We will quickly move and finish it. Abrasion for indicate scab formation, indicate the survival. If you see examine, you can see the scab formation indicates survival. True or false? If you while examine, you see that Scab formation is there over the abrasion. That indicates survival. It's true or false? Just true. Because of the vital reaction only, then only it produces sequence of changes. So when you see a autopsy or dead person, you see the abrasion, but they told it's inflicted at the time of the incident. We can tell it no, it was happened before incidents 2 or 3 days because scab formation is there. So its survival is confirmed. True. Develop dry scab in 24 hours. True, because around 12 hours wet scab, dry scab around 24 hours. In the notes you can see that, so that is true. Heal with no scar. True. Brush burn are seen in road traffic accident. Brush burn means the grace abrasion. That is called brush burn. So the fall and over the bony area, usually common single fall and road traffic accident, you will get that grace brush burn abrasions. That is true. Nail mark abrasions are always cosmetic. That's the thing, because this is, if you're asking the nail mark abrasions are crescentic, true. But nail mark aberrations are always crescentic false, because always mean 100% crescentic. No. Sometimes with the elastic appearance of the skin, and even you can get inverted crescentic shape or in the linear shape. Sometimes in the linear aberrations, you may get in the linear aberrations over the fingernail mark. So always mean false. But if they are asking mark commonly occur in crescentic, is true. So that's why when you are asking the MCQs, those important, you have to identify the all the words. Regarding aberration, aberrations are least important injury. That is false, no, because it will give more medical legal importance. Even though if it is non-grievous, it is give more medical legal significance. So least important means false. Indicate the direction of the movement of the weapon. True. Involve the full thickness of the skin. Full thickness of the skin. What your answer? Involve in the full thickness of skin ablation. False, because it's a partial thickness. By definition, it's a partial thickness. It's false. And it produce on mucosal surface. True, it can produce mucosal aberration, can commonly in skin, but can occur in mucosal surface, corneal surface. That also true. Pattern type indicate perpendicular force. True. Regarding contusion, cold bruises when localized to skin. But it's not thermal. But some person, usually some textbook consider that bruises indicate only in the skin and localized area. Contusions are occur in any of the area. So that's why they are asking. According to the book, some bruises indicate it's localized to skin. Contusion indicate all over the body. So when the contusions occur only in the skin localized area, some books consider as bruises. So in this time, if they don't ask this type of questions, usually this is only some books are mentioning the bruises. Then get yellow color when more than 18 hours. That is the only thing we can tell. No, I told when they are asking dating of the contusion only in the MCQs they can ask in this type of question. They don't ask other type of dating. But if it is yellow, we can confirmly tell it's more than 18 hours. Occur easily in elderly because there is elderly people more vulnerable to get to damage the blood vessels. Even simple trauma or simple injuries, they will get more bleeding. Rambling conditions occur with the fingertips. That is false. No, fingertip is a discoid contusion. So it's a round shape discoid appearance. Rambling condition usually associated with a cylindrical or elongated weapons. Conditions occur easily in palm and soles. That is false. That's why usually the hiding places, contusion or injury hiding places. In torture cases, usually they selected places where the injury resistant place, such as palms, soles. So they assaulted repeatedly the palms and soles because we don't see contusions. So easily we don't easily seen mean false. So that's why palm and soles are injury resistant regions. We can rarely see the condition. Very difficult to see condition in palm and soles. Regarding laceration, irregularities through blood vessels of the base are clearly divided. That is false. No, clearly divided means it's a cut injury. Heal with permanent scar. True. Deglowing is due to rotatory effect of fixed surface. That is the moment no, run over injuries and all the things we will get. Crescentic appearance is caused by hammer head. So that is hammerhead. Usually over the assaulted the head area, we usually we get this type of part of the impact is impact, we will get recently type. Condition can be differentiated from hypostasis. So you will answer this question. Conditions can be differentiated from hypostasis. So you can understand the question. So extravasation of the blood, true or false? What is your answer? Infiltration into tissues, extravasation of the blood, true, yes, because that's how we have to differentiate. Extravasation of the blood is true. Infiltration into tissue, infiltration into tissue, true or false? True, yes. Can be seen in deep parts of the body. What is your answer? Can be seen in dependent part of the body. Can be seen in dependent part of the body. True or false? Can be seen in dependent part of the body. Condition can be differentiated from hypostasis. Can be seen in dependent part of the body. False, yes. But here you have to understand, if they are asking contusion only, not asking about the differentiate from the hypostasis, it's true because contusion can be seen dependent part of the body. Can be seen, no. But our main question is contusion can be differentiate from the hypostasis. So can be seen in dependent part of the body, cannot differentiate from hypostasis because hypostasis also occur in the dependent part of the body. That's why this term is false. So when you answer this question, if they ask contusion can be seen dependent part of the body, is true. But the question is can be differentiate from hypostasis. Well, to differentiate to hypostasis, dependent part of the body is okay, it's false. So it's false. Good. It's okay in internal organs. It's true now. Contusion can occur in internal organs. Now, what do you think about this question? It is occur in internal organs. True or false? What is your answer? It's occur in internal organs. True or false? That's why I told it can internal hypostasis also can occur in internal organs. Contusions also can occur in internal organs. So here our main aim is to contusion can be differentiated from hypostasis. So when occur in the internal organ can be differentiated from hypostasis. False, no? Because it's not the answer, not for the differentiation, no? Like this can be seen in dependent part of the body, not will help to differentiate the hypostasis. Same, it can occur in the internal organs, not will help to differentiate from the hypostasis. So the question is, contusion can be differentiated from hypostasis. It occur in the internal organ. Even if it is occur in the internal organ, we can't differentiate because hypostasis also can occur in the internal organ. So that is false. Disappear on blanching, false, because with the blanching, condition cannot disappear, but with the blanching, hypostasis will disappear. So other way around, the hypostasis can be differentiated. It's true. Disappear on the blanching, hypostasis disappear, but condition not disappear. That's why it's false. So when you are answering that C and D, very careful, even though it is true, our question is can we differentiate from hypostasis? So it occur in the internal organ means ultimately they will check your knowledge whether you have knowledge regarding hypostasis occur in the internal organs and conditions also in the internal organs. So if you know the hypostasis occur in the internal organs only, you can tell it's false. Otherwise, you may mistake. So basic understanding what is hypostasis, where you can see hypostasis, because hypostasis can occur on internal organs also, in the lungs, liver, heart also we can see internal organs hypostasis. So that is false. Condition also can occur in internal organ, hypostasis also can occur in internal organ. Regarding step injury, edges of the wound are clearly cut through. No? fishtail appearance is 1H2. Shelving. Shelving occurs due to tangential impact. What is shelving? True or false? Shelving. I will tell that shelving area because this is shelving is true because tangential means shelving means that is usually the tangential impact. There was a undercutting and shelving. So I can't able to read the pictures. Usually in the tangential means this is the type. So when the cut is occurring the tangential force, so this how it's a step is there. So you can get step injury here. So this end of the area we will call it as undercutting. This area we will call it as shelving. So the tangential force only you will get this type of shelving area. This is undercutting side of the skin part or tissue part. So that is tangential impact is true. Then we will move length of the wound determine the width of the weapon. That is, I already mentioned, it's true. Because of the length of the weapon will determine the width of the weapon. And stab injury caused by sharp weapons, length of the wound is greater than depth. So I don't want to again this questions are come, you can go through it and read and incisive wound also same. That this regarding incisive wound, the punishment is more for grievous hurt when comparing to sharp. So because the sharp and blunt, if it is same grievous hurt, same intention, but if they are using sharp weapon, the punishment is high because that means he keeping the sharp weapon with the purpose of some assault, home assault activities or some violence activities. So that's why when there is a same injury but causing blunt weapon is very the punishment is less. One using sharp weapon, the punishment is high. That's why they are asking. Then other things you will know that when there's a lesser bleeding and laceration falls, the inches wound usually identified by the underlying bone cut. So that is true. When the inches wound, we can see underlying bone also cut. When it's clean and heal quickly, usually wound is inches, that is healing quick also true. Broken glasses can cause true because broken glasses can cause cut injury, inches wound, any laceration, any form of injury. So this is already repeated and it's also same. Regarding injuries, hilt mark is an imprint abrasion. Usually hilt mark means that hilt means there is a knife you will handle. Knife handle causes this type of hilt mark. So when stabbed, you will get hilt mark. So that is perpendicular imprint abrasion. That is true. Clavicular fracture is often due to direct impact. Usually clavicular fracture is occur in the indirect because fallen on side of the shoulder. Usually they will get because the mid part of the clavicle will be very thin, so that is fracture. Fracture. So clavicular fracture is usually common in indirect fracture. Defense injury occur commonly on inner aspect of the forearm. Usually while descent, they will show the extensor surface of the hands and the outer aspect of the legs. Usually outer aspect of the forearm is true. Inner aspect means false. Commonly occur means false. Absence of defense injury always exclude the violence. What do you think? Absence of the defense injury always exclude true or false? False. True. False. Because absence of defense injury means patient's unconscious stage. Sometimes patient's hands were tied severely. They can't defend. So always mean false. Vertebral fracture more suggestive of road traffic accident rather than assault. What is your answer? Vertebral fracture more suggestive of road traffic accident rather than assault. True or false? Vertebral fracture. True. Yes, because why is the reason is when you get fracture in the vertebra, that indicate the severe more force. Because simple assault with the weapons or simple cutting or simple assault with a wooden pole doesn't cause that much of severe force. So severe forces occur during the road traffic accident. There is a whiplash injuries, acceleration, deceleration movements, and thrown away. So those type of severe form of force will occur generating by road traffic trauma. Road traffic trauma, you will get more uh, severe form of injury. So that is most of the time vertebral fracture occurs, severe form of injury. You can't create that type of severe force by assault. So most of the time vertebral fracture is occur, it indicates severe force that occur in the road traffic accident. So it's true. So then defense injury seen on accessible side. That is true, no? Usually while defense usually it's accessible side. But that in this indicate that defense injury means only it's not on the accessible side, because sometimes you can get defense injuries in the back of the chest also, because sometimes if you tie the legs and the hands, most of the time they try to change the position and they show the back of the chest. So that is not the accessible side. So defense injury seen on accessible side is usually we consider as false, because it can seen in the back aspect of the chest also. Usually the self-inflicted injury only is true, seen on accessible side. So that is false. Cut injury is seen on palmar surface of the finger. Usually cut injuries, while defense they will grip the forearm or grip the weapon, so knife or something, so that cut in the palmar surface. Indicate homicidal attack, true. Defense injuries indicate homicidal attack, no, that is true. Seen on the forearms, true, no, forearms and legs you can get. Multiple parallel injuries. What is your defense injuries? Multiple parallel injuries. That is your answer. True or false? Defense injuries, multiple parallel injuries. That is your answer. True. Because multiple, while defense means it's not a organized manner. So they can change the position. They can show the limbs, and suddenly they can change the position. The parallel means it's an organism. Someone should be keep the hand and cut, or someone should be keep the steady position and do. So parallel means that, so that is usually occur in the self-inflicted, not the defense. So parallel injuries means false. So accessible side false, indicate that is seen on the forearms through. Multiple parallel injuries usually occur in the self-inflicted injuries, because we can't usually defense injuries, it's not organized. They can run away, they can change the position, so we don't expect parallel injuries, parallel to each injuries. So that is false. Regarding contusion, dark red color indicate condition more than 1 week old. That is false. No, dark red color immediately seen. Color changes is due to cellular infiltration. It's true or false? What is the if you know the main mechanism, you can able to answer. Regarding contusion, color changes is due to cellular infiltration. What is the mechanism for the color changes of contusion? If you know that, you can answer this question. Color changes is due to true or false? Due to cellular infiltration. True or false? Color changes due to cellular infiltration. So how is the contusion occur? False. Yes. False is the correct answer. Your color changes usually blood will come out from the extravasation and interstitial space, not the intracellular space, interstitial space. So interstitial space there is a blood. Then what will happen? Usually it will change the sequence of changes of the red blood cells. So red blood cells, there is a hemoglobin part in there. So earlier it's red color, then carboxyhemoglobin blue color. Then it will change into the biliverdin, it's a green color. Then it's come to the ultimately final yellow color. It's a bilirubin. So biliverdin, bilirubin. So these are the changes. So because of the changes of the hemoglobin only, it will appear. Then it will usually it will come to the surface of the uh, skin with the percolation, because inside there was a condition. Then it will come to the surface of the with the time we will come to the surface of the skin. So initially we don't see condition. After 2 3 days, it's a prominent because the percolation that will come towards the periphery surface. That called percolation. So that is shows prominent condition. So color changes due to hemoglobin changes, hemoglobin and deoxyhemoglobin changes. The prominence is due to percolation. It will come to the surface. So with normal skin, its width of the weapon is tramline condition. What is your answer? Width of the normal skin is width of the weapon in the tramline condition. True or false? So when the tramline condition is there, so what is the width? How you identify the width of the weapon? Measuring the normal skin between the tramline condition, give the width of the weapon. True or true? Yes, true. Because I already mentioned on here the width of the weapon only. The normal skin indicate the size of the impact of the weapon. The edges of the tramline contusion only indicate the edges of the weapon. So normal skin indicate the width of the weapon. So can mistaken with putrefaction, you know, contusion usually we can putrefaction there was associated hypostasis. Putrefaction also changes sequence of color changes, so it can mistaken. So true. Green contusion is due to bilirubin. So what is your answer? Green contusion is due to bilirubin. True or false? False. It's bilirubin. No, green. Bilirubin means yellow color. Bilirubin. It's false. So that is, yeah, it's false. And self-inflicted injury, usually deep. False. No. Usually self-inflicted injury is a accessible region, superficial. Usually they are using sharp weapon rather than blunt. Usually they produce sharp weapons, accessible region, sparing the clothes. So those are the features. Typically caused by blunt weapon falls, rarely over the vital organs falls because usually they will select, they don't select the vital organs. They will, because most of the suicidal, self-inflicted injuries, they get attention. They don't want to die. So most of the time, they want to get the attention. So that's why commonly they don't use the vital organs. Handedness hand no value, that's also false because usually in the right hand person we can see the cut in the left forearm. So handedness has no value means false. Commonly find on the back, that is false. Accessible side. So those are the questions answers. Rarely over the vital organs, true. They don't rarely they select the vital organs. Blunt weapon is deep, also false. And last, ultimate, final questions. Only we will see one single best answer, and we will going to finish this lecture. So here also the last questions you have to it's the single best answer. So there should you have to find the keywords. Then only you have to identify the correct question, correct answer. The young boy was found dead on a pool of blood at his home. Young boy, pool of blood. There was a pool of blood was there. The deep oblique cut injury was seen on his neck. Deep oblique cut injury. And there were multiple shallow cuts. So that is the keyword. Multiple shallow cuts at the border of the cut injury. So at the border of the cut injury, there is a multiple shallow cuts. There were also heel scar in his left forearm. Heel scar in left forearm is the other keyword. Heel scar of his left forearm. What is the best statement that describe following incidents? So what is the best incident? What is the best circumstance? So you see the injuries due to rotatory machinery, injuries due to assault by sharp instrument, homicidal cut throat manipulated by assailant to mimic suicide, self-inflicted cut injuries in psychiatric patient, self-inflicted cut throat of suicidal motivation. So what is your answer? You have to go to the all keywords because there are several stems, two answers are there, but you have to select the single best answer. Even with the true answer, you have to select the best answer. That is called the single best answer. Sometimes there may be a two or three correct answers should be there. So what is your answer? all are put E. So here both D and E are true. D and E are true. That is no. So what is how we have to exclude one by one? Injury due to rotatory machinery we have to exclude because it can't produce heel scar on the left forearm. Heel scar on the left forearm, so that's produced. Injury is due to assailant by the sharp instrument. That also again heel scar in the left arm. Usually assailant it's not possible. That also excluded. Homicidal cutthroat manipulated by assailant to the mimic of suicide. That is possible only if the neck injury is there because cut injury was there, neck injury is there. So when you are homicidal cutthroat manipulated by assailant, how will you demonstrate this keyword heel scar in the left forearm? So that is not the heel scar. No? If it is heel scar means it's happened on 3 to 4 days back. So that automatically indicates it's previously several attempts was okay healed. This heel scar is the other important. There was several times it's happened. So that is the important thing. The heel scar is also homicidal cutthroat was out because even if it is correct, but we can't demonstrate that is not possible with the steel scar in his left forearm. That's why all keywords you have to go through. So then there are ultimately two will come. Self-inflicted cut injuries in psychiatric patient, self-inflicted cutthroat of the suicidal motivation. So both are possible, but what is the best answer? Best answer is the psychiatric patient because why? If they find some steel scar in his left forearm, that indicate he is several previous attempt. So not the first attempt of suicidal motivation. So that's why we have to know the answer is D. Because why is that? Because young boy was found on death pool, deep oblique cut injury was seen on his neck. Then multiple shallow cuts means usually in psychiatric patients and whatever the patient, they will get into fear while cut. They will cut several times and there is a one cut indicate that is a fatal cut. So only thing is the heel scar in his forearm indicate there are history of several attempts in previous time. Self-inflicted injury is more suggestive of psychiatric phenomenon and even though the both E also true, but self-heal scar more suggestive of that is due to psychiatric patient. So that's why the single best answer is not an easy thing. You have to consider all circumstances and come to the best answer. Because even though there are several true answers are there, but we have to find a selected a single best answer. So we have to fulfill all keywords should be we have to fulfill and then only come to a diagnosis. So this is repeat the heel scar indicate repeated several attempts in the past history. So that indicate there was a psychiatric assessment, psychiatric issues, even self-inflicted indicate there are psychiatric issues was there in the previous time also. This is not the first attempt he tried to suicide. So that's why it's a single best answer. It's important. This answer is D. Okay, thank you very much. And I think you can get some idea regarding the injuries and the head injury and how to answer the questions when they ask in the MCQs. And you can get past paper and do it again and again. And you will have an idea regarding how to answer the question. So you know why if you know the main mechanism and understanding the mechanism and basics of the injuries or any topic, you can able to answer the question. If you know the anatomy and what is the basis of the injuries and what are the things usually in the injuries and injury part in the forensic most of the time like that. If you know the basic mechanism and understanding, then you don't miss and you can able to answer all questions. So thank you so much with joining with me and thank you all and good night.